So now we are going to study the side of the neck. And when we study the side of the neck, this is the mandible, this is posterior, this is anterior, this is the trapezius muscle, trapezius. This is the midline neck, midline line of the neck when you look from the side. Trapezius. So this whole thing, and here is the clavicle. This whole thing looks like a quadrangle. Look here, mandible, clavicle, trapezius, midline neck. And this quadrangle is divided by a muscle into two parts, sternocleidomastoid. The reason it is called sternocleidomastoid because it is attached to sternum as well as clavicle, so cleido. There is lesser supraclavicular fossa in between the two heads, between the sternal head and the clavicular head. Okay? Now here is the hyoid bone. Hyoid bone is here. Hyoid. Okay? So, hyoid bone is one bone which is not attached to any other bone. हवे में कुछ लोग कैसे हवे में रहते हैं वैसा ये बोन हवे में रहता है, खाली मसल्स अटैच्ड है. लॉट ऑफ फॉरेंसिक importance is involved for hyoid bone. So people, what they do, they want to kill anybody, that person is sleeping, they go there and they strangle it, and then they feel कि कुछ नहीं, वो रुमाल लेके, they have seen in the movie, रुमाल, gloves पहन के, and then they try to say अरे वो तो रात को सोया था, सुबह उठा ही नहीं, तो हार्ट अटैक आ गया नींद में. So then body is sent for postmortem and fracture of hyoid is seen. Okay, so ऐसा कोई छुपता नहीं कुछ भी चीज. You person is caught. You do some crime, doctors will catch you, those who are attending anatomy lectures regularly. Okay, otherwise you will also miss and people may keep on killing. Dishan, thank you. Now this hyoid is attached. Now here is the one muscle which is arising from the scapula, upper angle, upper part, and its name is omohyoid. Inferior belly of omohyoid and superior belly of omohyoid. There are two bellies of omohyoid muscle. This omohyoid divides this, of course, sternocleidomastoid divides the quadrangle. या ओळीतला शेवटचा मुलगा उभा राहतो. तू माझ्याकडे इतक्या वेळ बघायचं नाही रे, पटकन उभा राहायचं. काय शिकवतोय मी इकडे? नंतर sternocleidomastoid divides this quadrangle into two triangles. Posterior to it is posterior triangle, anterior to it is anterior triangle of neck. Posterior triangle of neck and anterior triangle of neck. Posterior triangle of neck is further divided by omohyoid into a triangle which is big, which is called as occipital triangle, and a triangle which is small, which is called as subclavian triangle. इसको और actually छोटा बनाना चाहिए ऐसे. Okay, this is subclavian triangle. So two triangles. Posterior triangle is divided into two triangles. What are they? Occipital triangle and सबक्लेवियन ट्रायंगल. अँटिरियर ट्रायंगल, काय नाव तुझं? काय नाव? प्रियांशु. प्रांशु. कहाँ से आप? नागपुर. जोरात ओरडू. नागपुर. And here there is one more muscle called as digastric. Digastric. Gastric means stomach, belly. A muscle which has two bellies is called as digastric. Above the digastric is digastric triangle. Below the digastric is carotid triangle. Here is muscular triangle. And hyoid goes here. And here is submental triangle. So anterior triangle is divided into 4 parts. Digastric triangle, submental triangle, carotid triangle, muscular. This we will study in the next session. Currently, let us focus here. Okay? Skin, superficial fascia, deep fascia, they form, not deep fascia. Now when it comes to deep fascia of the neck, deep fascia of the neck, the fascia, deep fascia of the neck is called as cervical fascia. Cervical fascia. This cervical fascia has 3 layers. Investing layer, prevertebral layer, and pretracheal layer. Investing layer, prevertebral layer, and pretracheal. Okay, so deep cervical fascia has 3 layers. Deep cervical fascia has 3 layers. What are they? Investing. So investing layer is superficial. Okay, it is amongst these 3, it is superficial. It is deep to the superficial fascia. So what investing layer will do? It will cover trapezius. Then it will unite. It will form the roof. It will form roof of this triangle. Again it will enclose sternocleidomastoid and it will go ahead. Okay, so what investing layer does is it covers the like it is parotid gland. It will cover the parotid gland. It will cover the submandibular gland. So it is said it covers 2 muscles, trapezius, sternocleidomastoid, 2 glands, parotid, submandibular, like this. So it runs from here to here, investing layer. Okay, starts from the mastoid, from mastoid to mandible. So when it runs from mastoid to mandible, it will split and enclose the parotid gland. Again it will go like this, split, enclose the submandibular. Come here, lower down it will be attached to the clavicle, it will be attached to the scapula, it will be attached to the sternum. So lower down its attachment goes like this. Upper attachment will go like this, the way my finger is moving. Starting from mastoid, mandible, it will come here, this side mastoid, nuchal lines. So this is how investing layer is attached. In short, you can imagine something like a collar, investing layer, and like going down here, investing layer. But it is quite superficial amongst the 3. When you will study the thorax, you will study that this is the sternum, manubrium sternum, and then you will study the posteriorly there are the vertebrae. This is the diaphragm. This is the superior aperture. Here is the heart. This is the heart. Okay? When you will study the thorax, that time you will be taught what I have drawn is the space between the 2 lungs, which is called mediastinum. space between the two lungs is called mediastinum. This mediastinum is divided, here is around T4 vertebra. So superior and inferior mediastinum. Okay. And heart and pericardium divides the inferior mediastinum into anterior mediastinum, middle mediastinum and posterior mediastinum. This is superior mediastinum. Okay. Again you will be taught this mediastinum. So why I am teaching you mediastinum today? Only then you will understand these three layers which are there in the neck. Prevertebral layer covers all the muscles covering the vertebral column anteriorly, and it gets attached at the level of T4 like this. T4 it gets attached to the vertebral column. Okay. You have studied one structure related to prevertebral layer in upper limb. Krishan. So prevertebral layer of the deep cervical fascia, it covers all the muscles covering the vertebral column anteriorly, and at level of T4 it gets attached here to the vertebral column. Now this prevertebral layer, all the nerves and all in the even cervical region, whatever they are coming from the spinal cord, the brachial plexus now, they will pierce it and they will go. And this prevertebral layer provides them a sheet. This is called as the axillary sheet. Okay, it provides them the sheet. Okay, through the structures going to the axilla. So now, if somebody gets a tuberculosis of the cervical or the upper thoracic spine, there is pus formation here, pus formation here. This pus formation will pass through this sheet covering the brachial plexus or the axillary sheet, and the pus will appear here in axilla. Pus will appear in axilla. Patient will come to you and saying that there is pus here. And if you have missed today's lecture, जैसे कि ये सामने वाले बेंच के लोग मेरे को दिख नहीं रहे, आपके रिप्रेजेंटेटिव्स हैं, सो उनके पास जब ये केस जाएगा तो ये उधर ही लोकली ट्रेन करेंगे, पेशेंट को घर पे भेजेंगे, 5 दिन के बाद पेशेंट वापस आएगा, पस आ रहा है, फिर वापस ड्रेन करेंगे, पेशेंट घर पे जाएगा, वापस आएगा, फिर वो वहाँ से निकल के तनिष्का, डॉक्टर तनिष्का के पास जाएगा, तनिष्का इज सिटिंग ऑन द फर्स्ट बेंच, या रमित के पास जाएगा, तो रमित को फिर याद आएगा, प्रीवर्टेब्रल फेशिया फॉर्म्स व्हाट, एक्सिलरी शीट. सो नाउ ही विल से क्या रहे, लीजन इधर नहीं है एक्सिला में, लीजन इज हियर. Okay, then he will take an X-ray of the cervical spine, the upper part of the spine, and he will find there is tuberculosis, and then just give anti-tuberculosis medication. That pus discharge will stop. This is anatomy. So this, once you understand that prevertebral layer gives sheet to those, it forms the axillary sheet to the nerves arising from brachial plexus, and therefore the pus from the upper part of the vertebral column can appear in the axilla. Thank you. Now pretracheal sheet. Pretracheal, it will cover the thyroid gland and all, and then it goes and gets attached here. So this is prevertebral, this is pretracheal. Okay? Krishan, stop. So we are discussing two layers here. Pretracheal layer of the deep cervical fascia gets attached to the structures around aorta. Prevertebral gets attached here. Now there are 3 chances of pus formation in the neck. And how does it go? How does that pus travel? Pus in front of pretracheal layer will pass from superior mediastinum to anterior mediastinum. Everybody agrees to this? Okay. Pus behind the prevertebral layer will be restricted to superior mediastinum because prevertebral layer gets attached to T4. It never goes into posterior mediastinum. Clear? And pus between the pretracheal and prevertebral layer will pass from superior mediastinum to posterior mediastinum. I'll repeat again. Pus in front of pretracheal layer will pass from superior mediastinum to anterior mediastinum. Pus between pretracheal and the prevertebral layer will pass from superior mediastinum to posterior mediastinum. Pus behind the prevertebral layer will remain restricted to superior mediastinum because it gets attached here at T4 level. It never passes through posterior mediastinum. This can be one of your MCQs for terminal PG NEET super specialty. You got this concept? Okay. Now this muscle, sternocleidomastoid. तनिष्का का तो बहुत तेरा डिस्टर्ब किया मैं स्टडीज 110820 मेरा इसका पिन कोड इनकेस कभी बंद हुआ तो sternocleidomastoid. It has two heads. Sterno starts from the sternum, upper part of the sternum. Cleido is from the medial and superior surface of the sternum. Sternocleido up and gets inserted on mastoid. And sends aponeurosis to the nuchal line also. This muscle is supplied by spinal accessory. Now it is the brother of trapezius. Trapezius is also supplied by spinal accessory. There are two actions of these muscles. When you are asked action of sternocleidomastoid, you say single muscle and double muscle. Single muscle acting, like if right side this is acting, it pulls the mastoid and turns the face to the opposite side. Okay? Turns the face to the opposite side. Left side का करो, आपके right side का करो, सब लोग right side का. Left का करो, left का. हाँ, बिल्कुल घड़ी को देखने का नहीं कोई भी. हाँ, no use of left sternocleidomastoid. Okay? The students use it बार. कब खत्म होगा? No. Turns the face to the opposite side. Another action is turns the ear towards the shoulder. Turns the ear toward or brings the ear closer to the shoulder. This is lateral flexion of the spine. So one rotation and one lateral flexion. Okay? So this is one muscle acting. Two muscles acting together. The sternocleidomastoid brings the face forwards, as in eating. हर बार आप खाना खाते हो, बराबर है कि नहीं? आप ऐसा करो. Brings the face forwards, as in eating. Along with the longest scala, it also causes this action, flexion. It also brings the face down. And the third action is when the head is fixed, because this is attached to the sternum, it pulls the sternum up in forced inspiration. So when you see a patient who is having, difficulty in inspiration difficulty and is doing forced inspiration, you will see the sternocleidomastoid. Whenever he is breathing, you will see the sternocleidomastoid because it is pulling. So that's how you identify that the patient has breathing difficulty. With every inspiration, you will see sternocleidomastoid becoming prominent. Thank you. देखो एनाटॉमी सीखोगे ना, आपको ये सब आपको याद आएगा उधर वार्ड में, आईसीयू में. स्टर्नोक्leidomastoid ज़्यादा खुश नहीं होने का, लेकिन अगर पेशेंट का मिजरी भी समझ ठीक. So now let us come back here. Let us come back here. The floor of this, the floor of this triangle, posterior triangle, is formed by three muscles. I'll start with some names which you know. And the first one is levator scapula. ये आपने नाम सुना है कि नहीं? मैं इसे चाकू यूज कर रहा हूँ. Levator scapula. Now स्प्लिनियस कैपिटिस, सेमी स्पाइनलिस कैपिटिस, ये नाम आपने सुने नहीं है. सेमी स्पाइनलिस कैपिटिस, सेमी स्पाइनलिस कैपिटिस, कैपिटिस attached to skull, spinalis attached to spine, from spine to skull, semi. If this is splenius capitis, this is splenius capitis, this is semi-spinalis capitis on the half side. Okay, semi-spinalis capitis, splenius capitis, levator scapulae, all covered by which layer of deep cervical fascia? Prevertebral fascia. Prevertebral, because it will prevertebral covers the vertebral column and the muscles anterior to it. समझ लो. Okay, so in short, the roof will be formed by skin, superficial fascia and investing layer, and some nerves which I am going to talk about. These nerves are contents of this. They appear in the roof. There is external jugular vein also. External jugular. So roof is formed by skin, superficial fascia, investing layer. Floor is formed by levator scapulae, splenius capitis, semispinalis capitis, covered by prevertebral layer. Okay, so prevertebral layer covers the floor, investing layer forms the roof. Okay, now here there are muscles like scalenius anterior, scalenius medius, scalene muscles, scalenius medius, scalenius posterior, scalenius posterior. Okay, so there are scalene muscles, scalenius, SCA, scalenius, scalenius medius, scalenius anterior, scalenius posterior. So I am now again rubbing them. Okay, but just you remember three scalene muscles. Mostly the scalenius posterior forms the floor. बरोबर ना? कृषांग आप किताब खोले हैं. Scalenius posterior mainly forms the floor. Okay. So now फ्लोर हो गया, रूफ हो गया, उसके बाद क्या आता है? कंटेंट्स. कंटेंट्स. स्टर्नोक्लेडोमास्टोइड फ्लेक्स किया अपना अभी. क्या नाम है तुम्हारा? हाँ, तेजस्वी. कुठून आलीस तू? ओके. हाउ टू रिमेंबर द कंटेंट्स? क्या हो गया? बंद हो गया. ये इधर सबको मालूम है, पूरे डिपार्टमेंट को मालूम है. तो बताएं, मैं बताता हूँ. हाँ, सो the contents. Now I am telling you the easiest way of remembering the contents. Everybody is with me? युधिष्ठिर किधर गए? युधिष्ठिर तो कब से बीमार है, तो बीमारी है. क्या हो रहा है? कुछ तुम ये श्रावण सरीबिन बादल की बरसात उधर जा रहे हैं क्या? हाँ, किधर है ये लोग? PR किधर गई वो लड़की? PR ओए ओए, तू ही पूछ रही थी ना कि PR के लिए जाना। मैं बोला जो PR तो उतना डरने का नहीं, क्योंकि जैकी श्रॉफ ने बोला है PR करने वाले कभी डरते नहीं। हाँ हाँ, जहाँ प्यार है उसको तो अनिश का तो घर पे वो ग्रामोफोन है क्या तेरे? अच्छा 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 अच्छा, क्या नाम है उसका? कारवा। The nerves arising from the cervical plexus are the contents of occipital triangle. तो यहाँ पे क्या रहेंगे? Nerves arising from cervical plexus. While in this triangle, there will be nerves, not nerves, there will be brachial plexus. Here there will be cervical plexus, there will be brachial plexus. ये बेसिक आपको याद रखना है, ओके? बोलता हूँ, ये बेसिक याद रखना है, हाँ? ना ब्रेकियल प्लेक्सिस आपने पढ़ा था जब आप आए थे। ब्रेकियल प्लेक्सिस मैंने आपको याद है मैंने आपको पढ़ाया था ब्रेकियल प्लेक्सिस। तो उसमें वी स्टडीड व्हाट वाज द न्यूमोनिक? RTDC, रूट्स, ट्रंक्स, डिविजन्स एंड कॉर्ड्स। तो एक्चुअली in the upper limb, infraclavicular are only chords. Divisions are retroclavicular and roots or trunks are supraclavicular. Roots and trunks are supraclavicular. Oh, third round. Roots and trunks are supraclavicular, जो आपने मिस किया था। So यहाँ पे you see what? Upper trunk, middle trunk. You'll see the three trunks. What you are seeing here is trunks and nerves arising from those trunks, roots and trunks. There are 4 nerves arising from roots and trunks. 2 from the roots, 2 from the trunk. What were they? Long thoracic nerve, nerve to rhomboids, dorsal scapular, or nerve to subclavius and suprascapular. उसमें से खाली जो dorsal scapular nerve है ना, वो यहाँ पे दिखती है, इस ट्रायंगल में दिखती है। तो बाकी के जो nerves है, suprascapular, nerve to subclavius, long thoracic, वो subclavian triangle में दिखते हैं। Subclavian triangle is also called as greater supraclavicular fossa. Pranshu. What is other name for subclavian triangle? Greater supraclavicular fossa. That girl, white scarf. What is lesser supraclavicular fossa? Between the two heads of sternocleidomastoid. Between the two heads of sternocleidomastoid is lesser supraclavicular fossa. Okay? उसके डीप में इंटरनल जुगुलर वेन होती है। What is greater supraclavicular fossa? Subclavian triangle. Is it clear to all of you? Okay. बैठ जाओ। अभी यहाँ पे कुछ आपको नर्व्स मिलेंगी सर्वाइकल प्लेक्सस की। देखिए, there will be lesser occipital, there will be greater auricular going to the, there will be transverse facial, and there will be three supraclavicular nerves. बरोबर? 3 supraclavicular nerves. 3 supraclavicular nerves. वो भी आपने पढ़े हैं supraclavicular nerves. सो रही है? स्टैंड अप। तू ना जमात से तुस ब्लैक ड्रेस। क्या नाम है आपका? कृष्णा नाम है इसका। So where have you heard of supraclavicular nerves? ऑरेंज शर्ट, ऑरेंज टी शर्ट. हाँ, आपका नाम क्या है? हाँ, क्रिश. खाली क्रिश. ऐसा ही है क्या सब पूरा क्लास? तो भक्ति भाव. Where have you heard of lateral supraclavicular nerve? Characteristics of clavicle. It is the only bone which is pierced by a nerve. So which is the nerve which is piercing? The supraclavicular nerve pierces. So Krishna, the supraclavicular nerve is this, arising. It's a branch of which plexus? Cervical plexus. So you may not have heard of lesser occipital. You may not have heard of greater this thing, but you may not have heard of transverse cervical. Transverse cervical going to the, but you have heard of supraclavicular. Okay. So the nerves here are lesser occipital, greater auricular, transverse cervical, and supraclavicular. Clear? Nerves here are three trunks of brachial plexus, and here there is one more dorsal scapular, and notus subclavius, long thoracic, suprascapular. Clear? Now let's go to the arteries. Artery here is occipital artery. ऐसे यहाँ पे दिखती है occipital artery. Occipital artery. Artery here is subclavian artery and subclavian vein. अभी मैं यहाँ पे एनाटॉमिकली अच्छे से नहीं दिखा पा रहा हूँ सबक्लेवियन आर्टरी और वेन को. इसका रीजन मैं आपको बताता हूँ मैं क्यों नहीं दिखा पा रहा हूँ. देयर इज वेन, देयर इज आर्टरी, और दोनों के बीच में, क्रिश जस्ट चेक द डायग्राम, दोनों के बीच में देयर इज स्केलेनियस एंटीरियर. इसके पीछे देयर इज स्केलेनियस पोस्टीरियर. Scalenus medius. So what happens is, what is happening is, आपने वो पढ़ा है ना कि pectoralis minor divides the axillary artery into three parts. सब divides into three parts. वैसे scalenius anterior divides the subclavian artery into three parts. Three parts, 1, 2 and 3. Subclavian artery का continuation is axillary artery, which is divided into three parts by pectoralis minor. So axillary artery is anterior to scalenius medius. मैं इसको ऐसे करता हूँ. चलो, I'll make it simple for all of you. Axillary artery is posterior to the scalenius anterior, anterior to scalenius medius. So this is scalenius medius. This is subclavian. मैंने axillary बोला गलती से. Axillary artery, scalenius anterior, subclavian vein. Clear? Okay. हाँ, बताने वाला हूँ इसके. इस पे फोकस. Stop. Okay. So now we are discussing the posterior triangle. Posterior triangle is formed and boundary is anteriorly sternocleidomastoid, posteriorly trapezius, inferiorly clavicle, divided into two parts by inferior belly of omoid. Anterior triangle we will learn later. Roof is formed by skin, superficial fascia, investing layer, and external jugular vein, and these four nerves arising from cervical plexus. Floor is formed by semispinalis capitis, splenius capitis, levator scapulae, and the 3 scalene muscles. But these muscles are covered by prevertebral fascia. So prevertebral fascia forming floor, pre-investing layer forming the hood. When it comes to contents, you have to remember cervical plexus is here. Cervical plexus. Nerves. The lesser occipital, greater auricular, transverse cervical and supraclavicular. Okay? And then there is the spinal accessory nerve. Most important spinal accessory nerve. Because if you are operating on some pus formation in the sternocleidomastoid and if you take a cut along the posterior border, spinal accessory will be damaged and trapezius gets damaged, then there is no overhead abduction. Then there is no shrugging of shoulders. Okay? Here there are roots and trunks of the brachial plexus and nerves arising from the roots and trunks, suprascapular, long thoracic, now to subclavius, except for dorsal scapular, which is here. So cervical plexus, brachial plexus, occipital artery, subclavian artery. This is how you remember the contents of posterior triangle. Thank you. Now here I have drawn, this is anterior, this is posterior. This is scaleneus anterior, this is scaleneus medius. Subclavian artery lies posterior to scaleneus anterior, which divides it into 3 parts. It is anterior to scaleneus medius. Subclavian vein is anterior to scaleneus anterior. So this is how the contents of the subclavian triangle are. And then there will be the brachial plexus. Okay, thank you. क्या अरे